Good morning, everybody, and welcome for a webinar on the last episode of mechanical injuries. We have studied first two episodes of mechanical injuries yesterday, and today we will discuss on the last part of mechanical injuries. We have studied what is injury, what are the mechanical injuries, and then we studied two types of mechanical injuries. Those are abrasions and bruises. Bruises are also called as contusions. And today we will study the other parts of mechanical injuries, and those are lacerations, incised wounds, and stab wounds. Plus, we are going to also study the miscellaneous part of mechanical injuries. So I welcome you all back for the study of mechanical injuries, the remaining part. First, we will discuss laceration. What is meant by laceration? Just look at this image. You can see the boy who is having a wooden log in his hand, and if he hits that, with a great force on somebody's body, especially bony parts of the body, it is certainly going to cause laceration, and the wound of laceration will appear like this. You can see this wound. So this is a grievous injury. What we saw in abrasions and in bruises, contusions, those are simple as compared to this. Now, what is a laceration? Laceration is also called as wound, actual wound. मराठीमध्ये फाटणे किंवा चिरफाड होणे असं म्हणतात. So laceration is a wound in which tissues are torn due to heavy, hard, and blunt force applied to the body. They are also called as tears or ruptures. For example, hit by a lathi, lathi, I have a lathi here for, for some reasons I'll tell you afterwards, or a blow, or in road traffic accidents, these lacerations will occur. You can see one picture here where police mama is hitting a road Romeo, probably is a road Romeo. So he's hitting with a police, stick, but this will cause tramline bruise or tramline contusion. But the same stick is applied with a great force may also cause lacerations. So it is included here. Here you can see a simple lacerated wound. This comparatively is quite simple, but if you see the edges, it looks lacerated. What are the characteristics of lacerated wounds? It involves injury to some different layers and parts of the body. There may be fracture of the bones or dislocation of the bone of the joints. That is why fractures and dislocation are included in the lacerated wounds. Some put them in a separate category, but usually it should come under lacerated wounds because it is parts and parcel of this lacerated wound. The shape and size of injury do not correspond to the weapon, mostly. Okay, so what weapon has been used to cause this lacerated wound? It is not easy to make out. The margins are irregular, they are torn apart, and the wound is swollen, and it is also contused. Hemorrhage is usually less because the vessels are crushed and torn across, hence they bleed less sometimes. Hair and hair follicles can be crushed in this injury. Well, let us now discuss about different types of lacerated wounds. Those may be called as split lacerated wounds. Split means to get splitted apart, or a stretch lacerated wounds, or avulsions. Avulsions म्हणजे सोलणे, सोलून काढणे. Tears म्हणजे फाटणे. Cut lacerations म्हणजे तुटणे. So this all comes under lacerated wounds. Well, we have to understand the medico-legal significance of lacerations or lacerated wounds. Lacerations are usually seen in accidents and assaults. Accidents means abghat. Assault means halla. Okay. The suicidal lacerations are rare as they are painful. Usually, the person will not, cause laceration or lacerated wound on his own body. You saw that wound. It is not so easy to cause one wound on your own body because it's very painful. So lacerations are usually not found in suicidal cases. They are rare. The type of laceration may indicate the cause of injury or the shape of the weapon. So you'll get idea about the weapon which is used to cause this injury. Foreign matter may be found in the wound, which indicates the crime circumstances. गुन्हा कुठं घडलेला आहे, कसा घडलेला आहे याची सुद्धा माहिती थोडी मिळते. फॉरेन बॉडी, फॉरेन मॅटर्स जर त्याच्यामध्ये मिळाला तर. So these are usually grievous injuries. So because they are, we saw the wound and they're highly painful and which is vast also. How to make out the age of lacerated wound or a laceration can be seen as a fresh or 1 day later, 2 days later, 3 days or 4 weeks whatsoever. Initially means fresh lacerated wound looks red because of bleeding. After 12 to 24 hours, you will find clotting there. After 18 to 36 hours, you'll find pus formation because of bacterial role. After 1 to 2 weeks, there will be a formation of granulation tissue. So this is a healing process again. And after 4 to 8 weeks, the healing of fractures if present, they can see, or the wound gets healed. So 4 weeks means almost a month. 8 weeks means 2 months. So 4 to 8 months is quite a long period. So these lacerated wounds are included in a grievous hurt or grievous injury. In short, lacerations means the breach in epidermis and dermis. Breach means a gap. Crush injury, common where the skin straight over the bone. So those places are skull, face, sins. Sins means anterior, compartment of the leg. Margins are bruised and abraded. Tissues not clearly divided. Tissues bridges across the base of the wound. These wounds also bleed profusely, and they are caused due to falls, due to kicks or blows from different objects. These wounds are commonly known as gusses or tears or cuts of the skin. The skin surface is split or torn following blunt trauma, and the force causes the full thickness of the skin to be damaged. Lacerations therefore also bleed profusely. To know more about lacerations, we have to see the areas of the body that are commonly the site of lacerations. I told you that the bony, parts, underlying bony supports such as above the eyebrows, on the scalp, on the face, because there are subcutaneous bones there, on the knees and on the shins. While they are less common on the areas of the body that are softer, such as buttocks and abdomen. Contact with motor vehicles may also cause splitting of the skin due to grinding type of movements over the surface. The most severe being a deglowing injury. Lacerations have ragged wound edges as they have been torn apart, and they are not neatly incised. Incised wound means when you take a scalpel and cut, that is incised wound. That is neat. These are not neat. In surgical wound, it is neat. So scalp lacerations sometimes resemble inside wounds when they have been caused by a regular shaped object. If the wound is examined closely, the ragged edges can be visualized along with the crushing and bruising of the margins, hairs driven into the tissues, and tissue strands crossing the depth of the wound. Well, here there is one picture of lacerated wound. You can see laceration there just above the medial malleolus, okay, on the lower limb. It's quite clear. Now we will try to understand what is incised wound. Incised, incision. Lacerated, laceration. It comes from these words, basic words. Incised wounds are also called as cuts. They are called as slash. They are called as slice wound, slash wound, cut wound. So it is a wound produced by a sharp weapon, such as knife, blade, scalpel, etc. Okay, and it's a clean cut through the tissues, which is longer than its depth. So length is more than the depth, and usually common instrument which is used for the lacerated, for the incised wounds is a knife. You can see a knife, it's quite common also. Here you see one incised wound on the hand, on the palm, on the what you call hypothenar eminence, you can see the clear-cut edges of the wound. The edges are smooth, clean cut, everted, and free from contusions. You find contusions in laceration, but not in the incised wounds. If an incised wound is caused by a heavy weapon such as dandasa, the edges of the wound may show contusion. So that is with the instrument is very heavy. That is why the starting of incised wound from where it starts is deeper, and it gradually becomes smaller and tails off towards the end. The tailing off of an incised wound shows the direction by which the weapon was drawn off. So that helps for diagnosis that is required for medical legal importance. If the blade of the weapon enters the body obliquely, the tissues will be visible at one margin and the other margin will be undermined. So it's called as beveling cut. Now, how to make out the age of incised wound? So if injury is non-gaping means there is no gap. Healing is like an abrasion and results without scarring. Like see, the fresh incised wounds have a hematoma formation. After 12 hours, you'll get the edges are red and swollen. After 24 hours, cap of dried clot is seen. After 36 hours, the capillary network is complete. After 2-3 days, the wound is filled with the fibroblast and the capillary bursts in the form of cut surface. After 3 to 5 days, definite fibrils are seen. Vessels show thickening and obliteration. And by the end of first week or up to 2 weeks, you can see a scar formed there. Okay. Here you can see one picture of a scar caused by incised wound. So don't look at this red thread. This is a red thread, doraito. You see this one, which is vertical here on the hand. You can see that wound was incised wound which is closed and which was stitched. And नंतर त्याचे टाके काढलेले आहेत. You can see that clearly. So you can see one scar here, linear scar, what is called as. And there you can also see the stitches, scar marks. What is the medico-legal importance of incised wound? It indicates the nature of weapon. By looking at the incised wound, you can understand what type of weapon must have been used to cause this injury. It gives an idea about the site of impact and the direction of force. Okay, and the age of injuries can be determined. Position of wound may indicate mode of action, whether it is suicidal, accidental, or homicidal. The homicidal incised wounds, defense incisions are present on the dorsum of hand or also ulnar aspect of the forearm or also on the palm. Usually somebody tries to kill a person, say, and he's aware of that, he'll try to protect himself, and that will cause defense incisions also. Some post-mortem wounds may be caused by the criminal to hide the crime. So after killing a person by some other mean, they may also put some incision cut marks on the body to hide, the identity. In criminal cases happens. So in short, incised wounds are slash wounds. These are wounds where the length is greater than the depth. For example, slice wound across the skin that you saw. If the wound involves major blood vessels, it can be life-threatening. The person may die. But in general, they are not as serious as stab wounds. So more serious are the stab wounds. We are coming to that part after incised wounds. So inside wounds, they are caused due to sharp instruments. The length is greater than the depth. Wounds margins are uninjured. Deep tissues are cleanly cut. The best example is surgeon's inside wound. The surgeon, while doing surgery, operation kartana, they take an incision and that incision is clear. So that is incised. From that this name has come. Here you can see a surgeon taking an incision on the anterior aspect of the forearm. See how clear it is. There is no much gaping here. This is a typical example of incised wound. Now let us try to understand stabbing. By looking at this picture, we see that this person has been stabbed at the wrong place. Okay, let's have another image. Look at this image. You can see the horrible scene here. So you can see such a big wound and there's a lot of gaping. You can see it looks to be more deep than the length. Of course, it is a stab wound. Stab wounds are also called as puncture wounds. In Marathi, bhosakne is a common word. Khupasne, bhokasne. The stab wound is an injury caused by a sharp pointed weapon when the sharp tip is thrust into the body. Okay, I have a tocha here which is used in the office. It's not a screwdriver. Screwdriver is also same. Tocha is also same. This can also be used to puncture. So stab. Here you can see the multiple stabs here on the back of this body. This person is probably killed. You can see lots of stab wounds seen here. And with this stab, because they are quite deep, and certainly the vital organs here you can see around here means it must have reached heart, lung, liver place. You can see kidney place here. So person has of course he's a dead body now here. What are the characteristics of stabbing? In stab wound, the depth is more as compared to breadth. So it's opposite of incised wound. It is caused by sharp, pointed and cutting instruments such as knife, dagger, nail, needle, spear, arrow, screwdriver. I told you about tocha also. Scissors also can be used to puncture or poke in. Rampuri chaku is very famous for such kind of stab wounds. Dagger, okay, katyar. So stab wounds are called penetrating wounds when they pass through tissues and they enter body cavity like thorax and abdomen. Usually head has got a tough skull bone. A sharp pointed cylindrical or conical instruments, they produce a wound with circular margins. When puncture wound is hidden, it is called as concealed puncture wound. Example, puncture wound found in fontanelles, inner canthus of eye, ear, etc. And healing is usually by scarring. But these are more dangerous and grievous injuries. What is the medico-legal importance of stab wounds? Stab wounds are mostly suicidal or homicidal because even though it is a grave injury, if I use this torch and if I hit it in my stomach or on my heart, I can kill myself. Similarly, I can kill with this other person, homicidal. Accident wounds of stab are quite rare. Different story here. Position, number, and direction of wounds may indicate mode of action. So, how the suicidal stab wounds appear, how accidental appear, and how homicidal appear. They depends upon number and position, direction. The shape of the wound may indicate the class and type of weapon. The depth of the wound will indicate the force of penetration. Direction and dimension of wound indicates the relative position of the assailant and the victim. Assailant means marekari. Victim means the person who gets affected. तर पाठीमध्ये वार केले असतील तर आपण समजू शकतो ना की मारेकरी पाठीमागे होता, त्याच्या मागे होता, म्हणून त्याने मारलेला आहे. Likewise, the age of injury can be determined. Now, circumstances of incised and stab wounds we'll try to understand. Accidental wounds are usually caused by fall upon a sharp-edged object. विळीवरती विळा वगैरे आपण accidentally पडू शकतो, त्याची जखम होऊ शकते. Impact by sharp object, for example, glass pieces. An unintentional cut or stab by sharp-edged or pointed object, for example, knife, blade, household appliances, etc. And suicidal wounds. In most cases, we may found wounds in multiple number, parallel and superficial in any one accessible area of the body, such as neck, wrist, and groin. Rarely on the backs of the legs and the chest, okay, because they are not approachable. Suicidal cut throws are usually seen above the thyroid cartilage. The direction is from left to right because people are mostly right-handed. Multiple to 30 wounds may be seen on the other parts of the body. The clothes are not cut and the circumstantial evidence may be helpful. We have to make out whether the wound is suicidal or homicidal. Unintentional cuts are found on the fingers where blade has been gripped, okay? Because wrongly you can grip a blade and that can also cut your finger. More than one method may be used for a suicide. In right-handed persons, the most severe wounds are often found on the left side of the body, and vice versa. What are homicidal wounds? Homicidal wounds need multiple gaping wounds on any part of the body, including back. Defense wounds may be found. Wounds, particularly on the breast and genitals, indicate sexual offense. So, in short, stab wounds are caused by long objects. They penetrate the body. Small surface wounds are depth-wise. Shape depends on object penetrating inside the body. Stab wounds where the depth of injury is greater than the length of injury. They penetrate more deeply than the slash wounds and tend to become in contact with the vital organs in chest and abdomen. Stab wounds are caused most obviously by knives, but are also caused by bayonets and swords. तलवार किंवा तलवारीसारखी इतर असणारी हत्यारं, as well as scissors and even blunter instruments such as screwdrivers. They're common instruments, household. Stab wounds are usually slit-like. When the object is removed, the skin contracts slightly, leaving a wound that is slightly shorter than the blade width. The center of the wound often widens. Here you can see a few household instruments which are used for stabbing. You can see a stab wound here, and you can see one stab wound stitched over here. You can see there are lots of other instruments seen here, the pencil, you can see scissors, you can see a syringe, you can see a screwdriver, a knife, and you can scalpel. These are all used for the purpose of stabbing. They also cause incised wounds. You'll find these all instruments in your forensic medicine and toxicology laboratory, or you can say demonstration cases are available in all the colleges. You can see different, even there are swords available and other instruments are also available in the laboratory. Here you can see the different instruments here which can cause different types of injuries. Here you can look at these injuries, how they look. If you use a scalpel, if you use a knife, if you use a fork, if you use a knife. Okay. Here you can see one knife, and the knife has got a handle and you've got a blade. These are the different nomenclature of the parts of this knife. You can see the grip, back, spine, edge, and the point. Here you can see the skin wound where how this knife has been driven inside the body superficially or deeply. Here you can see the superficial penetration at this level, mid level you can see here, and deep penetration you can संपूर्ण चाकू जेव्हा घुसवला जातो तेव्हा deep penetration म्हणतो आपण. And we have finished the stab wound. So we have finished all lacerated wounds and we have finished all incised wounds and the stab wounds. But apart from these injuries and those injuries which we saw earlier, that is abrasions and bruises, there are some other injuries also, which are called as wears, glass injuries, axe injuries, plus thermal injuries, which we are going to deal with it in a separate topic. Firearm injuries we are going to deal with at a separate topic. Defense injuries, I told you, when a person tries to defend an assault. Self-inflicted injuries means person tries to injure himself, herself. Mostly they are suicidal. So in miscellaneous part of mechanical injuries, we need to know what the reals means. It's called a triple response. Or defense injuries of assault, which are present on the arms, hands, and legs. Or self-inflicted injuries, which are haphazardly present on the arms and body in mental disorder persons. Or tentative injuries are also called hesitation marks, which are seen in suicide attempts as short, shallow wounds on the wrist or on the neck. Okay. What to know about the age of injuries and how that depends upon the color changes in the bruises. It is from purple to yellow. Scab formation in the abrasions, scabbing and scarring of the lacerated wounds. Histological examination of the tissues will give you exact age of those injuries. Not all the injuries will cause death, but some injuries will cause the death. So those injuries which cause the death are called as fatal injuries, and they may cause death. And death takes place due to hemorrhage. Hemorrhage means excessive bleeding. Okay, due to damage to vital structures, all the vital organs, brain, heart, liver, lungs, and kidneys. Shock, hypovolemic shock, infection, septicemia, sepsis, pulmonary thromboembolism, acute tubular necrosis, and fat embolism. All the injuries which are affecting the life of a person are called as offenses affecting life, which are mentioned under chapter 16 of Indian Penal Code 1816. So Indian Penal Code has got over more than 500 sections, 514 sections at present, I think. That code and codified book get amending again and again. There may be repeal, or there may be amendment, or there may be addition of new sections. And there are some common sections because those types of crimes happen again and again in the society. So we'll try to see the different sections here. Section for hurt 319, section for grievous hurt 320, section for voluntary causing hurt 321. Depends upon what type of injury, for what intention the injury has been caused by an assailant or by an offender on some person, because the crime has to be registered in a police station, and the police station has, I have to mention the section in the FIR. For that purpose, you have to know major sections. So in this chapter, those sections we related only to the mechanical injuries I have taken. So for example, section 323 is for punishment for voluntary causing hurt. Section 325, punishment for causing voluntarily grievous hurt. So there is different punishment for that. Other section like 326 for causing grievous hurt by dangerous weapons. 326 for causing grievous hurt by use of acid. 326B for grievous hurt by use of acid. Voluntarily causing hurt to extort properties under 327. 328 is for causing hurt by poisoning, by giving poison with intent to commit an offense. Section 329 is for voluntarily causing grievous hurt to extort the property or to constrain to an illegal act. So it depends upon the intention of the person and type of injury and type of mean utilized, and from that the police officer will try to recognize what section has to be applied under FIR. 330 is for voluntarily causing hurt to extort confession and to compel restoration of the property. And a few more sections we have here which are related to the mechanical injuries. 331 for causing grievous hurt to extort confession. 332 for voluntary causing hurt to deter public servant from his duty. 333 for voluntary causing grievous hurt to deter public servant from his duty. 334 for voluntary causing hurt on provocation. 335 for causing grievous hurt on provocation. 336 for endangering life or personal safety of other people. 337 for causing hurt by act injuring life and personal safety of others. 338 causing grievous hurt by act injuring life or personal safety of others. There are many other sections for assaults also. I have just tried to quote here a few IPC sections which are related to mechanical injuries. You can get this in the book, you can get it on the internet also. Try to go through it. Must know at least the related IPCs to the subject concern, the topic concern. I think with this we have to end this webinar on mechanical injuries. And I have completed the mechanical injuries topic. And next time we will deal with firearm injuries. So thanks for watching, and hope you learned a lot from this session. If you have any questions, you can ask me. Well, I hope you all have understood this topic thoroughly. So let us stop here and come back again in the evening with a new topic, and that is firearm injuries. Thank you. Thanks a lot. Have a nice day.